Hello, I'm Peg Bolgioni, Marketing and Communications Manager for Southern Vermont AHEC, and I'm pleased to welcome you to another episode of Let's Talk. Our programs are focused on topics surrounding health workforce development in Vermont, as well as vital alliances we have nurtured with numerous partners. This show will spotlight National Children's Dental Health Month, which happens during the month of February. Southern Vermont AHEC is a nonprofit educational organization dedicated to growing and sustaining Southern Vermont's health workforce, especially in our rural and underserved communities. Welcome back to our show. I'm very pleased to have with me three special guests, and we're going to be talking about National Children's Dental Health Month. And so I wanted to introduce them. This is Marty Hammond, and Marty, you are the Oral Health Coordinator.
Right, at Southern Vermont Area Health Education Center.
Okay, and Barb, why don't you introduce yourself?
Yes, I'm the Director of Dental Services for North Star Health. We're a federally qualified health center serving communities in Southern Vermont and southwestern New Hampshire.
Okay, and Tammy?
I'm Tammy Mosier. I'm the Executive Director of the Stratton Community Foundation.
All right. Well, we're going to jump right in because we have a lot of information to cover. So, Marty, I'm going to start with you. As the Oral Health Coordinator with Southern Vermont AHEC, what are the primary goals of your position with the organization?
My primary goal is to provide oral health access to people of all ages and stages of life. And we started out doing this with a coalition that we formed in the Springfield area called ROHA, Rural Oral Health Access, that Barb and Tammy have been part of since, I think it's been close to 10 years since we started doing that work, trying to focused on kids, but people of all ages.
All right. And Barb, why don't you tell us about your position with North Star Health?
I'm the Director of Dental Services. We have two dental clinics in North Star. We have one in Chester and one in Ludlow, and we are very proud to serve all the patients in our community. I'm also a dental hygienist, so I started off there as a school-based dental hygienist with North Star, and so it's kind of nice that I have that position too, because I can every now and then fill in if I need to, but I have that clinical background too.
Well, and let's talk a little bit more about that. I mean, you do a lot of outreach with elementary schools in partnership with Southern Vermont AHEC and with the Stratton Community Foundation. Can you share with us some of the projects that you've got in the queue right now?
Absolutely. I'm pleased to say that we're back in the schools. Of course, COVID shut us down a while ago, and but we're back in the schools right now. Right now, we have a dental hygienist, Lisa Watson, who is an employee of North Star. She's a registered dental hygienist. She has been seeing children in the Two Rivers Supervisory Union. Those are schools in Chester, Andover, Cavendish, and Ludlow. She's also been in some of the schools in Wyndham Northeast Supervisory Union. She's seen students in Grafton, Westminster, Bellows Falls, and Saxons River. These are grant-funded schools, and so she's able to provide her services to those children free of charge. We're going to be dabbling our feet very soon into the Springfield school system. Starting this month, she will be providing educational programs to the younger grades, handing out toothbrushes, and you'll be talking about that probably, and doing some classroom presentations there. So we're very happy about that. Our clinics starting Thursday, when February starts, we have toothbrushing charts that all of our patients will be getting. We have special stickers and posters. We're also making this particular event noticeable in our other medical clinics and the vision care, behavioral health. We'll be having posters and stickers and that for all the kids. So it's going to be a lot of talk about dental care this month.
Excellent. And Tammy, I know that you work closely with Barb and with Marty, and so can you tell us about the Stratton Community Foundation and your mission?
Sure. We are a grassroots nonprofit that cares for the children and families in Southern Vermont. So it's that really rural mountain area that sits in the pocket between Bennington, Rutland, and Brattleboro. And so our mission is to address the challenges that stand between a child in need and the opportunity to thrive and learn. Our vision is to help children and set them on a path for academic success and economic independence. And to do that, we focus on addressing challenges of hunger, oral health, mental health, basic necessities, and innovative education. So we've been around for a while. Over the years, we've grown to become a fundamental cornerstone to school programs, schools, communities, families, and most importantly, the lives of children. To give you a sense of our growth, in 2014, our contribution to the community was about $140,000, and last year it was over $700,000. So, you know, like I said, we award grants to community organizations that provide critical services that are aligned with us, but we also innovate and create our own programs.
And how long has the Stratton Community Foundation been in existence?
Since 1996.
Okay, so you've got
So we've got some.
a few years under your belt.
Yeah.
And has the mission changed over time? I mean, did it start out with one particular focus and then morph into other areas?
It was started by a group of community-minded people that lived and worked around Stratton, and so they gave to everything. They gave to arts and sports, and then, you know, as a nonprofit matures and you realize that you need to focus on a mission and be focused, we decided to really address generational poverty. And that's how we've evolved into kind of focusing on those major pillars.
Yeah, and I imagine in the communities that you serve, there is a very high poverty rate.
Yeah, some of our schools witness up to 80% of children that are living at or below poverty. At first measured by that free and reduced lunch, and thankfully we've evolved where kids get free food at school. But still, those indicators are there.
Yeah, definitely. And Marty, can you illustrate how Southern Vermont AHEC is interfaced with the dental community?
Well, we participate in many different organizations. On a national level, I am the grassroots representative to the Open Network. OPEN stands for, I have to read it, Oral Health Progress and Equity Network, and I work in partnership with Dr. David Neumeister, who is a retired dentist from Brattleboro, and he is the state rep. There's national meetings, there's the Zooms and all sorts of education available online, especially since COVID. On the Vermont state level, there is the Vermont Oral Health Coalition that is facilitated by Robin Miller, who is the head of that Department of Health. Then there's 802 Smiles. Dr. Deborah Texera facilitates that group. It meets monthly online. And through Open, I've become friends with people in the New Hampshire Oral Health Coalition. We once had a training in Rutland, and they came to Rutland for that. So there's a lot of different organizations that we interact with. Coming up February 9th, there's a group of us that have joined with the Department of Health in White River. Barb's part of this. And we're going to do a free oral health clinic for adults. At least it's a Friday, so we're assuming kids will be in school, but it's walk-in and cleanings, and there will be multiple providers from North Star, including a dentist,
Yes.
And hygienist, and Dr. John Ekternock, who's from, on the state level, he interacts with 802 Smiles a lot, and so it's a first for us to put one of these together, and we're hoping for a good turnout. It's 8 to 5, and hopefully there will be lots of people there who need a cleaning and an exam. And if that goes well, we're thinking perhaps we can replicate it in the Springfield area.
That would be great. I've noticed that there's a lot of effort put forth by clinics and organizations like AHEC, of course, and the Stratton Community Foundation, that you do so much around dental care, health care. I guess I don't see that. I wish I could see that replicated in other communities, in other counties. I don't know if there is these activities going on in other counties in Vermont.
There was one in Bennington last month?
Yeah, in January,
Yeah.
we partnered with the Medical Reserve Corps of Southwestern
Sure.
Vermont, and we did a free pop-up down in the Manchester area. And so we were, actively partnering with them, finding dental hygienists, finding dentists. Then we also collaborated with the Stratton Mountain Resort and Neighborhood Connections, the community around just nonprofits trying to provide these critical services, trying to get transportation, overcoming the barriers of, making sure that children got down there
Right.
from the mountain towns.
No, I just think it's very impressive, the initiatives that you put forth, to bring this kind of awareness around dental health and regular health, et cetera. Barb, I wanted to, of course, we know we're going to be celebrating National Children's Dental Health Month, which is a big deal. And can you just tell us, maybe from your perspective, what it means, what the theme is this year, how other organizations can join in to help promote this, the importance of expanding dental health for children and adults?
Sure.
Okay.
The focus this year, or their theme, is Healthy Habits for Healthy Smiles, and this is put on by the American Dental Association. So they come up with the themes every year, and they have a lot of really good material that's accessible and free. So I've ordered some posters and some postcards and things like that, some handouts that I'll be passing along to Tammy as well for her schools. But really, when we think about dental health, years and years ago, it used your mouth was a separate part of your body, right? And the rest,
Right.
But now, now we know, that dental health is so important for your overall health. And not only that, it's important for your overall learning, your overall being. I mean, it starts right here. And so the poster is really cute because it just shows a whole bunch of kids. Some of them are brushing and flossing. They're holding asparagus. They're drinking water. And they're playing some sports. So we're just trying to make an awareness throughout the community that all of this is important, not just the brushing and flossing, but we want to talk about good nutrition. We want to talk about being active. We want to talk about, being engaged in the community. So, like I said, we're going to be passing out some posters to some of the libraries, to some of the children's programs. And so how can the community get involved? I'm hoping that librarians will start picking out, books about dental health from their shelves and reading them to children as they come, encouraging children to take these books out. I'm encouraging parents, take advantage of the school meals that your kids have access to. I've seen these snacks. I was in the school. I had a school-based dental program for a few years, and I saw the snacks that they were providing for the kids, and they're all healthy. There's grapes, there's cheese, there's oranges, there's water. They have carrot sticks and celery sticks, ranch dip, all that kind of stuff. All of that is really good for children. So if we can have good communication about that. We want to promote it within our clinics as well. That's why I said in our medical clinics, we're making sure that that kids have access to the dentist. So we have stickers with our clinic's names, Chester and the Ludlow Dental Center, with the names, with our phone numbers on there. We are seeing new patients. We do see children with Green Mountain Care. And that's a big deal. And we also want to encourage their parents to come along too, because if the parents are being treated from the tooth decay, the kids are going to have access to that too. It's very important for the whole family to become healthy. So we're going to try to encourage families to come in as well.
Yeah. Do you think that people tend to, I hate to use the word ignore, but they spend more time on their general health than on their dental health?
Oh, for sure, yes. And particularly we've seen, this happen since COVID, because we were the first to close down. right? And so we're still finding, you know, where are these people? You know, come back. It is so important. Yeah, you know, gum disease is kind of silent like high blood pressure, right? Unless somebody tells you that you have it, a lot of times you don't know it. You go to your doctor, you have your blood pressure taken, it's high. You do some life-altering, you know, adjustments, or you're on medication. A lot of times, though, what happens in your mouth, you don't know about it until it's too late. And that's when our clinics are getting calls all the time, you know, people with extreme pain, extreme toothaches, and things like that, because it's the, you know, it's last on their mind.
They tend to put it off.
They do.
And there's probably a fear, too, about
Absolutely.
going to the dentist. I don't have that fear, but I know a lot of people do, and it's almost paralyzing.
It
That
is,
they
right.
just don't want to go and deal with that problem.
Yep. And sadly, that gets passed down to the children.
That's right.
So if the parents are afraid to go to the dentist, then they're not going to take their kids.
Exactly.
And, right, and that's why programs like what Tammy's doing in the schools, what we're trying to do in the schools, is to like get to these kids, you know, to kind of a workaround,
Yeah.
you know, and then help the parents realize that there's nothing to be afraid of.
Yeah. Well, and it's something I think you just have to keep doing all the time, continuously. You have to keep hammering that message, you know, how important that is. And I think that's great that you all are doing that. Tammy, I wanted to ask you, and I know the rest of you are going to chime in because it is a collaboration, the event that's coming up with when you go into the schools and you do the dental kits. Can you tell us a little bit about that? You can start, and maybe Marty and Barb can jump
Well,
in.
we're actually doing a few things. We first met Barb in 2016, and she was our dental hygienist that went into some of our very high poverty schools. And so we had been doing that for quite a while, and then, as Barb said, COVID kind of shut that down, and we were like, how can we reach these kids? And so that's when we started at least working to get them the tools they need. And so every year we distribute over 2,000 dental kits to all of the schools in the area. I mean, so many teachers tell us it's a reason for high absenteeism. The one principal said, there's not a day that doesn't go by that I'm not putting Ambisol on a child's mouth just because of they're in pain. And you imagine they don't smile, they can't eat. I think it's more than fear, though. There's a mindset of, you know, when you're low income or living in poverty, you're struggling to think about your day-to-day survival. And so health becomes a privilege. We've given children dental kits, and they said that's the first time I've ever had my own brand new toothbrush. And so now we know that we have to get into those schools and give those kids what they need. Even Jamaica Village School with the dental kits, after lunch, all of the kids brush their teeth. Yeah, fantastic.
Oh, I think that's great.
Yeah.
And what about flossing?
We do floss. We also we give floss out. We give timers out so kids can actually get into the habit of feeling how long a 2-minute brush should be. We've given educational pieces thanks to Barb and Marty of, you know, cartoon videos, suggesting songs that a child can hum, and so that they know that's the duration of how long they should brush their teeth.
Yeah, the happy birthday song. Sing it twice in your head.
Yeah.
I just put the microwave on. I brush my teeth in the kitchen. I have the microwave on, so I'll know it's 2 minutes.
Exactly.
You do what you got to do, you know. But and so the I know Marty, Barb, you guys are involved in the distribution of these kits as well.
Right. Barb, since the dental clinic can order from a dental catalog, is ordering them, and then when they come in, I will put them together on my dining room table. I usually find a grandchild or two who likes this stuff. But it's, we have heard the same story from the school nurses in Springfield, that kids say, we share a toothbrush, or we don't have, or you know, things on that line. So it just feels like it's a really important thing to do, is to help families access things that many people take for granted.
If, you know, for people that are watching the program, I mean, how would somebody go about getting dental services for their children, or for themselves for that matter? How would they go about
It's really
doing
hard.
that?
I think right now the statistics are less than 44% of families have dental insurance. thank goodness, I have to applaud our schools who have gone beyond education to identify kids that don't have a dental home, have never been to the dentist. So access is a problem. When you can't afford transportation, and then the only dentist that will take new patients or will take Medicaid is in Massachusetts or New Hampshire. So bringing the dental into the schools is our priority.
But is it just a certain age group, or do you go beyond elementary school? What happens in middle school? What happens in high school?
Oh, we care for kids. We care for kids all through.
Perfect.
Yeah.
That's great.
Yeah.
That's great, because I know sometimes with these programs, it stops like at a certain age, and then that's it. You know, so they're kind of left to their own devices and whether or not they want to continue, you know, those good habits. But it's hard because
It
you
is.
know, you need to keep doing it over and over again, and you need to, and people need to set examples, and you know,
Right.
you all do that when you go into the schools.
And people need to, when they have an appointment, make sure they go to it.
Yes,
That's
absolutely.
another problem that Barb was.
We were just talking about that
Yes.
on the way up today. Just yesterday alone, I can't tell you how many people canceled their appointments, and I'm like, oh, we could have seen 15 other people,
I know,
right? You know,
I know.
you know. So just trying to, and we're reaching out more to these folks and just saying, you know, let us know if there's going to be an issue for you getting here, so that we can open it up to somebody else, and we'll get you in next week or whatever. But yeah, that's a
Part of
that's
it's
been a struggle.
training.
Yep.
Yeah. Well, I'm gonna do a little bit of a detour here, and I'm going to talk about dental health careers. And I know that we have a deficit in our state
Right.
around
Yes, we do.
dentists, dental assistants, and dental hygienists. I don't know if any of you can speak to that. How do we get more young people interested in dental health careers?
Would you
Anybody
like me to
want to?
start?
Anybody
I
want
can
to jump
start.
in?
I'll
Okay.
start.
All
We're
right.
actually having a Springfield High School student shadow at our Ludlow clinic next Tuesday.
Oh, great.
She's expressed an interest that she'd like to become an orthodontist, and so I've had a nice long conversation with her, and she's going to be coming and doing a job shadow for a day there, and then perhaps coming down to the Chester office. But that got me speaking with somebody at River Valley Tech, and Laura Peck, and I might be going in and talking to some of the seniors, juniors and seniors at her, you know, for her program to see if anybody's interested in science, you know, or the medical field. And a lot of times, if people are interested in the medical field, they think just medical, but not
Right.
but not dental.
Exactly.
And, you know, same with me. I thought, you know, well, years ago I was going to be a nurse. I'm like, well, why not? Maybe dental, and I'm so glad that I did. So I think it's, you know, encouraging kids to come in, job shadow, ask a lot of questions. When I was in the schools, seeing children all those years ago, they would be asking me questions. I'm like, you know, you should think about doing, you know, becoming a dentist or a dental hygienist. You know, talking about them at an early age, and certainly seeing what you can get.
Right. And AHEC has their prize student, Eve Pamazzi, who participated in the MedQuest, Advanced MedQuest, C-SHIP program, interned with Barb through the C-SHIP internship, and is a second-year dental student at Stony Brook in New York. And she has 2 more years, and then everybody will be wanting to hire her in Southern Vermont. She's from Brattleboro and just a wonderful young lady. And I believe she's writing an article.
Yes, Eve is a contributor writer to the Health Talk column that Rutland Regional Medical Center publishes every week. They feature a different medical topic. And because of the timing with dental health, you know, National Children's Dental Health Month, I had gotten in touch with Eve, and so she penned an article, which is going to be in the Herald this weekend and in the Times-Argus. And I'm hoping I can send that article out to other publications. It's very well written. Eve has a terrific way of communicating, and she kind of brings it down to a certain level so people understand and they engage with what she's trying to say. And she also is very gifted, animationist, I guess if I'm saying that word correctly. She created, I think, five dental videos that are just, they're genius. And we run them periodically on our social media channels, and I think, Barb, I don't know if they're, do you show them in the practices?
We're having 2 TV screens installed this week, so we can run them for next week. Yes.
And Tammy has used them in her schools as well.
Yeah, I
that's
send
right.
them to the teachers and say,
Oh.
please assign health homework, give stickers and everything when the kids come in and they say they brush their teeth, but the videos were absolutely adorable.
I swear to God, they're award-winning. I mean, she talks about sugar content, how to floss, how to brush, not being afraid of your first dental visit, and I can just watch them over and over again. Eva's amazing. I swear, I wish there were 100 of her, coming into the state. And you feel confident she's going to stay in Vermont?
Oh, I think so.
That's right. We're going to make sure of that.
Yes.
And I know some of the tech centers have dental programs, don't they?
Well, a couple years ago, Stafford Tech was going to put one in. I don't know if they have, but we are also trying to create summer career pathways for kids in 7th and 8th grade who to start thinking about your career, and we were going to partner with some of the tech centers. I'm sorry.
That's great. No, I remember. I remember Stafford. I'm not sure if they have the dental program or not. I know they did talk about it. They're expensive, with the labs and everything, but I think it's so necessary. Because if a student or a young person wants to go into dental hygiene, where do they go?
Oh, well, right now, it was VTC. Now it's
Vermont State University?
Yes,
Okay.
so Vermont does have a dental hygiene program.
Okay.
They do.
Okay.
Yes, and they have, well, I don't know where they have the nearest dental assisting program, but a dental assistant can be hired without any training at all. And so what we do is we grow dental assistants in our clinics, and have actually approached a couple of people that were looking for a career change and said, hey, would you like to come and train as a dental assistant? The training is done right clinically in the office with the dentist and other assistants helping. We send them off usually to down to Springfield or Tufts for their radiology training, which is very doable, and then they become what's called a traditional dental assistant. And that's how we filled a couple of the roles in both of our clinics.
Wow.
And they've become great team members.
Well, I think that's what you have to do.
Yeah.
Because if colleges aren't offering those programs, you have to be creative.
Or if you arrive, you have a career change. The Wyndham County Dental Center, at a meeting, a young woman who had just graduated from UVM with a degree in biology went up to the executive director and said, I'd really like to be a dental assistant. Well, she is now on the pathway in the dental center being trained to be a dental assistant with the long-term goal of becoming a dentist.
Excellent.
So,
because there's no dental schools in Vermont.
No.
Not even at UVM.
No.
Yeah.
Right?
And it's an aging dentist population,
Yes.
too.
Exactly.
So we've got
Yes.
the problem is going to get worse if we don't solve it soon.
I know. It's like electricians and plumbers. I mean, you're right. It's an aging workforce. What about dental practitioners? Is that like a nurse practitioner? Is that something that's coming about, or?
That's been a program that VTC has been working on now for quite some time. They're now looking at perhaps 2027. It's been pushed out a little bit for a number of reasons.
Right, COVID was the big one.
Was the big one. We actually, our Chester office was going to be, or still will be, like a residential center for some of these students to come and get some more training. So I've got things ready for them. I just need the students.
Okay.
And yeah, that's just what they're going to be is along the nurse practitioner.
Dental therapists.
Yep, they will be
Dental therapists, yes.
They will be able to do a lot of the restorative work that dentists can do. Very great for a school setting and rural community settings as well. Yes.
Well, that's great. Well, we're almost out of time, so I wanted to give each of you an opportunity if you had some final things to say before we signed off.
If there are any students out there, people of all ages who are interested in some kind of a career change or career pathway, come to AHEC, and we can certainly help students. And go to your local dental office, and if Barb would be happy to have you job shadow and explore.
All right. Okay. And
I would encourage parents to talk to their school counselors and nurses about things other than education as well. Needing to find a dentist, the school nurses and everything are just wonderful, and you can see that we have quite the network of nonprofits and everything willing to help.
All right, excellent. Barb, you got 14 seconds.
I'm gonna end with a quick little story. I was in a school quite a few years ago, and I always wear my dental loops and my scrubs, and when I'm walking around the hall, a little boy looked up at me. He was fiddling with his shoes, and he said, "Can you help me?" And I said, "With your shoe?" You know, I was gonna help him put his boot on. He said, "No, with my tooth. I have a toothache." You know, and that's what we have to think about, right? We're there for them, and anything we can do to help.
That's right. Well, ladies, thank you very much. You were terrific guests. You shared some very important information. And thank you again for watching Let's Talk on PEG TV. And if you want to watch us online, go to www.pegtv.com. Thank you.